Good morning, doctors. As part of our vision in Middle East homeopaths, we take an initiative to share the science behind each medicines in our Materia Medica. We encourage all of you who are interested in sharing their knowledge as part of our educational program. Today, we are going to share one of the most important medicine in our Materia Medica, that too from the animal kingdom in a nutshell. As usual, we have divided this topic into two parts. The first part is the scientific part, that is the science behind Sepia, followed by the homeopathic part. To have a scientific explanation of the Sepia, that is the cuttlefish ink, I invite my friend Dr. Ehab.
Thank you very much, Dr. Santosh, because it has come a time now to understand the science behind each medicines. Sepia. Why do you call it sepia? Basically, sepia is ink that composed of reddish brownish pigment. Reddish brownish pigment in Latin language they call it sepia. Same like gold for Orion, same like silver for argentum. So sepia is basically ink that used for painting, used for writings. Now it has been studied scientifically when sepia ink getting inside the body. So when you exposure to sepia ink, so what happens inside the body? First, it causes disorders of the melanocytes. And melanocyte is the one that produce melanin. So it causes overproduction of melanin, and that lead to formation of brownish spot in skin. It could be over the face or any other parts of the body. And also, this ink can cross the brain barrier and cause disorders in pituitary or hypothalamus pituitary axis, and that result in estrogen dysfunction and hormonal imbalance. Normally, hypothalamus produce gonadotropin releasing hormone. These hormones trigger the anterior portion of pituitary gland to release FSH. FSH triggered the ovary to make follicles and eggs, and eventually there will be massive production of estrogen. Estrogen is the one that helps the breast to grow, to develop. Estrogen also helps the hip and the pelvis, make the hip and the pelvis larger and wider. And now, because of dysfunction of estrogens, the breast is no longer developed and appears smaller than normal. And also the hip and the pelvis, it remains narrow and smaller and appears like male pelvis or android pelvis. And that is the reason sepia appears with the male pattern pelvis. And because of hormonal imbalance, you will find there is irregularity of the period and also infertility and symptom of polycystic ovarian syndrome because estrogen is low and male hormone is high. The ink also affects the elastin of the muscle and the connective tissue and make them weak. Could be any part of the body. And that is the reason you'll find that sepia always complain of prolapsed uterus. This is the result because of the weakness of the muscle and the ligament. The ink also affects the dopamine and serotonin, and that results in depression, anxiety, indifference, lack of interest, and other symptoms as well. And now I will call my friend Dr. Santhosh to proceed.
Thank you, Dr. Ehab, for your wonderful explanation about the sepia, the ink from which our medicine has been selected. Dear friends, all of you know that our master, Dr. Samuel Hahnemann, is the one who proved this sepia. And that too, it is an accidental proving. One of his intimate friends, who is a patient of Dr. Hahnemann, who was an artist means as a painter, who used to take medicine for his chronic ailments, and Dr. Hahnemann failed in curing his chronic complaint. And Hahnemann noticed that, and because Dr. Hahnemann is a great observer, he noticed that this painter always wet his brush with the saliva, and he suggested that this is the probable cause of his illness. So he advised that painter not to wet the brush like this, and he advised him to put a piece of sponge on the lips moistened with water, so that the mouth will be covered by this layer. And after a few days, almost all the diseases went off, which was the basis of this proving by Dr. Hahnemann. And the greatest features of sepia personality is whenever the sepia ink or the ink of the cuttlefish enters the blood-brain barrier, as said by Dr. Ehab, there will be total ptosis. That will be in physical, mental and emotional. This is the key word which is there in sepia. Ptosis means physical ptosis. There will be relaxation. Already Dr. Ehab explained that there will be estrogen deficiency in the body, as a result of which the two structural proteins which are there in the body for making the strengthening of the muscles, elastin and fibrin, will be less, as a result of which there will be weakening of the muscular system, including the uterine muscles, rectal muscles, and almost all. This is the ptosis in the physical level. And in the emotional level, the patient doesn't have any emotional connectivity. They are indifferent to their family members, aversion to their family members, indifferent to their children, angry. And in the mental level, mental ptosis also is there. That means they are very intolerant. They doesn't want to do any work, sitting silently, watching television or something. So ptosis is the first keyword of sepia. Second one, as said by Dr. Ehab, whenever it has the power to change the melanocyte pigmentation. So in the skin there will be melanin derangements in the melanin. That means there will be pigmentation, especially on the face or all over the body. But whenever you are facing this type of pigmentation, that will be a ring-shaped pigmentation. That is because of the derangement of the melanin. And the third one is when it crosses the blood-brain barrier, there will be estrogen deficiency. Whenever estrogen deficiency is, of course there will be a surge of the testosterone hormone, as a result of which all the body nature will be like that of a male. Even the pelvis will be small, narrow, will be a small breast. Everything is related with the testosterone hormone. And the final one is the female symptoms. The picture of the sepia fish is like that of a uterus. So the patient will have almost all type of uterine problems, including irregular menstruation, infertility, and all PCOD, and all types of uterine problems will be there because of the less estrogen production inside the body. So dear friends, if you could be able to understand and explain each medicines in a scientific way, that will clear the misconceptions about our system of medicine, and it proves that our medicine will have science behind each medicine. Thank you very much.